From our 22 News Broadcast Center, this is 22 News in Focus.
Good afternoon and welcome to 22 News in Focus. I'm Nick Oresco. March is recognized as Colorectal Awareness Month. According to the American Cancer Society, colorectal cancer is the third leading cause of cancer-related death in both men and women in the United States. The good news, the rate of people being diagnosed with colon or rectal cancer each year has dropped since the mid-1980s, mainly because more people are getting screened and reducing their risk factors. Joining me now to talk about prevention and treatment of this disease are two doctors from Baystate Health, Dr. Kais Zakaria, a gastroenterologist, and Dr. Daniel Fish, a colorectal surgeon. Thank you both for being on the program today.
Thank you.
Thanks for having us.
A series of questions, and obviously, as mentioned prior, both of you can answer, or at least have time to answer. It doesn't matter who goes first, just depends on the question that you want to answer. So we'll first start with the basics here. What is the colon? Explain what the colon is and what does it do? Okay. So we'll start with you.
Sure. So the colon is the last part of the gastrointestinal tract. It's a tube-like organ where the food will pass through. It follows the small intestine and it ends at the level of the anal canal where the food waste leaves the body.
Dr. Fish, we'll go to you next. What is colorectal cancer and are there different types of it?
Colorectal cancer is a type of cancer which is an abnormal growth that can occur in the body that is a result of genetic changes that can occur to the cells in the body. And the vast majority of colorectal cancer is one specific type called adenocarcinoma.
How common is this type of cancer?
So it's fairly common. It's estimated that 150,000 of newly diagnosed cancers will be made annually. Approximately 52,000 Americans will die annually from colon cancer. So as you mentioned, it's the third cause of cancer death in the United States.
And why is it so common?
Well, the colon, for reasons that are not entirely known, is particularly susceptible to cancer. It may have to do with the function of the colon. The colon receives the waste that we don't absorb from our food and also things that we take in from the environment, and it concentrates these things. It removes water from the waste and concentrates, and so probably a lot of things that can affect the body and cause cancer get concentrated here, and that makes it prone to cancer.
What are some of the risk factors for colorectal cancer?
So there are several risk factors for colon cancer. There are factors that we cannot control, such as the race. For example, African American would be at higher risk for colon cancer. Older age above 50 would be at higher risk for colon cancer. There are factors that we can control, such as diabetes, obesity, sedentary life, excessive alcohol use, and smoking.
So speaking of the demographic, are there certain, I know you mentioned some of them, are there certain specific reasons why more people see this type of cancer than others? You mentioned alcohol consumption. Any others? So as Dr. Fish mentioned, there are some genetic predisposition and there's also environmental factors. Those environmental factors include excessive alcohol use, smoking, obesity, diabetes, sedentary lives. Those are the risk factors. And also having a family history of colon cancer is also a risk factor for colon cancer, in addition to certain inherited syndromes, such as like Lynch syndrome, for example. Dr. Fish, what do you usually see when people come into the hospital and have colorectal cancer, demographic-wise? Are there more than others, certain types?
Well, age is a major factor, so the older someone is, the more likely they are to be susceptible to colon cancer. And like he was saying, you know, a lot of the things that we think of as kind of the basic tenets of being healthy are the things that affect colon cancer. So, you know, smoking and drinking alcohol, eating a lot of red meat, processed meats, being overweight, not getting enough exercise, So it's a lot of the things that are, the big headlines out there about being healthy relate to colon cancer.
Statistics, that's a word, shows that younger people are now getting this type of cancer more. Why is this happening? Is it better diagnosis or the impact of lifestyle or the combination of two? What are you seeing?
So unfortunately, it's not very clear. We definitely have better tools to make a diagnosis, but I think I would vote for the risk factors in this population, such as what we mentioned earlier. Yeah.
Dr. Fish?
It's a very troubling phenomenon. You had mentioned earlier that the rates of colon cancer have been decreasing with time, and that's true. But there's been another trend that has been recognized in the past several years, that there's an increasing incidence of colon cancer among younger people. And it's not very well understood why this is happening. It most likely relates to the risk factors we've been talking about. Whether there are other unseen factors that are not well understood at this time are unknown.
Do you think as technology gets better, we'll have a better understanding of why that is happening to the younger generation?
It's certainly a focus of great study, because this is a very troubling phenomenon, and it's affecting the way that we are screening for colon cancer. We at this point, we're not really sure why this is happening.
Younger generation, what are the age groups that you are seeing?
Well, the typical is, we start screening for colon cancer at age 50 because usually people weren't getting colon cancer until above this age. People with genetic predispositions have always been at risk for getting colon cancer at an earlier age. But now, more and more so, we're seeing people without genetic predispositions, known predispositions, in their 30s or 40s coming into the hospital with colon cancer. And an unfortunate fact is that with screening, we're more often finding colon cancers when they're at an earlier stage that are easier to cure. But when people at a younger age who are not being screened for colon cancer come in with colon cancer, it tends to be more advanced and harder to cure.
Okay, after the break, we'll learn about the diagnosis and treatment options for colorectal cancers. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about the diagnosis and treatment of colorectal cancer with Dr. Kai Zakaria, a gastroenterologist, and colorectal surgeon, Dr. Daniel Fish from Baystate Health. Dr. Zakaria, let's start with you and ask you about the symptoms of colorectal cancer.
Sure. So those patients usually present with unintentional weight loss, rectal bleeding, black stool, fatigue. If they do some workup, the lab workup will show some anemia as well.
When should someone start to consult a doctor, or at least think about seeing a doctor?
I think if the patient has persistent symptoms of what we already mentioned, they should seek medical help.
What are the screening options for detecting colorectal cancer?
So the gold standard for screening would be colonoscopy. The colonoscopy can be used as diagnostic as well as therapeutic option. There are other modalities that we can use, such as imaging, CT colonography, or capsule endoscopy, and some stool tests.
Dr. Fish, I'll move on to you now. How is the cancer evaluated and staged? What does an evaluation consist of?
Well, once the cancer has been diagnosed, then the next stage is to obtain some scans, which will help us to see where the cancer is in the body, how far it has extended, and whether there's signs of it having spread to other places in the body. This is usually done with a CAT scan, and there's a special area of the colon called the rectum, the very last area, and when the cancer is there, we'll usually also obtain an MRI.
What are the different kinds or types of stages?
So they're usually, there's a number of different systems that we can use to look at this, but the most basic one is stages 1, 2, 3, and 4. Stage 1 means a cancer that is very superficial on the inner lining of the colon. These are cancers that are the easiest to treat and cure. Stage 2 means a deeper penetration into the wall of the colon, and possibly even through the wall of the colon and beyond. Stage 3 means spread of the cancer to lymph nodes that are around the colon, which is usually the first place that the cancer would spread to once it gets beyond the colon. And stage 4 means spread to other places in the body. The most common places that the cancer can spread is to the liver and to the lungs, which both are organs that act like filters in some way for the body.
Do you see all types of these stages at the hospital?
Yeah, so we see patients coming in with all these different types of presentations, and how we approach things always depends on what the stage is. So the first step before any decisions are made are to figure out what stage the cancer is.
I want to talk about treatment now. What are the different types of treatment that is out there?
So depending on the stage of the cancer, sometimes surgery is used as the first treatment modality. If the cancer is in the upper part of the colon, the colon, then usually surgery is the first step unless it is stage 4 and the cancer is spread elsewhere, in which case we use chemotherapy to try to control the spread as the first step, and depending on how that goes, the patient may or may not be able to receive surgery later. When the cancer is in that last part of the colon called the rectum, we often seek to shrink the cancer first, and so we'll often give people chemotherapy or radiation therapy as the first steps, and then that will be followed with surgery. When the cancer is at an early stage, sometimes it can be treated endoscopically, which is something that Dr. Zakaria does.
Yeah, so we have different techniques for early cancers where the cancer is still superficial in the colon, so it did not invade the muscle of the colon. So we use 2 different techniques: endoscopic mucosal resection, or EMR. Those are left for cancers that are still like very, very superficial. And we have a different technique called endoscopic submucosal dissection. This is a new technique we have been doing. We can use it to remove cancers that are a little more advanced. And we have been building this program at Baystate to treat those cancers.
And how new is that?
Over the last few years to a decade.
So actually, speaking of technology, whether you have just been diagnosed or now going into surgery, what are the latest technologies being used for treatment?
Well, in addition to what he was saying, some other technologies that are being used are minimally invasive surgery. So classically, that's laparoscopy, using a camera and long instruments through small incisions, or the newer version of that is robotic surgery. So using all those same kinds of instruments, but all connected together with a pretty high-tech robot that the surgeon is actually controlling separately away from the patient, and kind of in a 3D environment. In addition to that, there are also a lot of new medications available for treatment, and new ways of using these medications. I was talking about giving the radiation and the chemotherapy as first steps. Those are newer techniques that we've found have been very effective in helping to cure people. And there's a new type of medication called immunotherapy, which is showing a lot of promise, especially for cancers that have certain genetic mutations that are really able to eliminate cancers in a much more dramatic way than what we've seen before.
Are those just trials, or that's actually full-blown, you guys are using them?
We're starting to use those things. I mean, they're just coming out of trials, and everything is always in flux. We're always trying to push things forward and advance the science in hopes of helping more people to be cured.
All right, great information there. We'll continue our conversation when we come back. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we're talking about the diagnosis and treatment of colorectal cancer with 2 doctors from Baystate Health. Let's talk about the follow-up care when someone is diagnosed and receiving treatment. And Dr. Fish, will begin with you. Who is on the patient's treatment team?
Well, the patient is usually diagnosed by a gastroenterologist, and then they're often referred to see a surgeon who will, kind of look at the bigger picture and help evaluate the staging and determine, what the treatment sequence might be. If chemotherapy may be needed early on, then they might be referred to an oncologist. A radiation oncologist could also be involved if the colon cancer is in the rectum. And then the patient will follow going forward with usually with the oncologist to keep an eye out after treatment. And there can be other types of physicians involved as well along the way, depending on what happens with the patient.
What types of monitoring tests are done during and after treatment?
Well, you do the staging tests as part of the workup of the cancer. After the cancer has been treated, it's very important that we keep a close eye on the patient because the cancer can come back again. And so especially for about the first 5 years after the treatment, patients usually will undergo blood tests every 3 months or so, and will undergo a colonoscopy every 1 to a few years, and will undergo CT scans every 6 to 12 months. And these are to look out for signs of the cancer returning elsewhere in the body, as well as look for signs of new polyps forming in the colon, because someone who has had colon cancer once is unfortunately at increased risk of having it again.
Do patients need to alter or restrict their diets?
Generally not. Usually, in the immediate aftermath of surgery, they may, but in the long run, most people can return to completely normal function after these treatments.
The Preventive Task Force changed recommendations for colonoscopy to begin at 45 now, as opposed to 50. We'll move on to you. What age should someone begin at least thinking about getting a colonoscopy, and why?
So we usually we used to start at age 50, as you mentioned, but nowadays, over the last few years, we have been doing it starting at age 45. The family history of the patient, if the patient has a family history of colon cancer, that can change when the colonoscopy should be recommended.
How often should someone get a colonoscopy?
So starting at age 45 and then every 10 years, that can change if the patient has a history of family history of colon cancer, or the patient has polyps.
Go ahead.
And it also depends on what type of polyp, how big the polyp is, what the pathology will show. All that we will take into consideration before we give recommendation for the repeat colonoscopy.
We've been saying this word colonoscopy this whole time. What is a colonoscopy? And obviously somebody may be a little bit anxious about the word, not knowing what it means. What do you tell a patient, one, what a colonoscopy is, and maybe try to calm them down a little bit after hearing that word?
So the colonoscopy, basically, we look inside the colon to see if there's any lesions. How we do that using the scope, or the colonoscope, which is a tube with a camera in the tip of it. We can go in, we can take a look inside the colon, see if there's any polyp, we take it out, or if there's anything that needs to be biopsied. For example, if there's a large mass concerning for cancer, we just take biopsy and come out. Yes, it is. It can be a challenging procedure. However, I always tell my patient that preparing for the colonoscopy is more challenging than the procedure itself. The procedure takes like 30 minutes approximately, and preparing it is probably the more difficult part, where a patient will have to drink a large volume of fluid, and they will have to go to the bathroom like for the entire day several times. So, but the procedure itself, usually it's an easy procedure.
You mentioned polyps. What are they, and if they're found, what happens next?
So polyps basically are clumps of cells. They can be benign, where it will never turn into cancer, or it can be precancerous. If it's a precancerous, and usually we can tell from the way it looks during colonoscopy, we basically remove it completely, and we send it to our colleagues in the pathology department to look at under the microscope to see what type of polyp it is.
Now, while there is no way to prevent cancer, there are lifestyle options to help reduce the risk. Either one of you can answer this question. What can somebody do to prevent this type of cancer? Is it even possible to prevent it?
Well, I think if I could tell people to do one thing, it's to get a colonoscopy. You know, don't be afraid. It's not as bad as you think. And it's the best way to both identify cancers, but also to prevent cancers by removing polyps. Beyond that, it's a lot of the things that we've talked about already. You know, things to be healthy. You know, try not to smoke, don't drink alcohol excessively, eat your fruits and vegetables, and you know, avoid eating too much meat. Get your exercise. Try not to be overweight. It's a lot of the really basic things about being healthy that help to reduce your risk.
Doctor?
I just want to add one more thing, that during colonoscopy we can remove polyps that are really large in size, as long as there's no deep cancer in them. We can remove them safely, and we can save the patient the surgery.
Is there anything else that someone should know about this type of cancer? Obviously it is curable, right? Anything else that you'd like to mention to a possible patient out there, or somebody who's worried about this cancer?
I think, you know, there's hope. You know, this is not the kind of cancer that's unbeatable. This is cancer that can often be cured, and the key is to take it seriously. You know, if you're having symptoms, don't be afraid to go to your doctor. Don't be afraid to get checked out. We can help you, and the sooner that we address it, the better your chances are.
All right, I'll have some final remarks when we come back. You're watching 22 News in Focus. You've been watching 22 News in Focus. Today we've been talking about the diagnosis and treatment of colorectal cancer with Dr. Kai Zakaria, a gastroenterologist and colorectal surgeon. I got that right until up to this last moment here. Dr. Daniel Fish, thank you both for being on the program today and giving us this insightful information.
Thank you for having us.
Thank you.
All right, and thank you for at home for watching. If you missed any of it, you can watch it in full on our website at wwlp.com. From all of us here at 22 News, have a great day.